the DNA synthesis inhibitors. Do you see those? Okay. And of all the DNA synthesis inhibitors, you really need to know about ciprofloxacin or Cipro. And I'm sure that everybody in this room has heard of Cipro, correct? Or ciprofloxacin, or some of the floxacins, right? Moxifloxacin, which is Avalox, Levaquin, oxifloxacin. So now is a good time to take our detour. Remember we talked about the female with a UTI, correct? Yeah. 80% of the time, what kind of an organism is it? E. coli. So I told you that when we help this patient, we're going to have to use empirical methods, correct? Empirical therapy. We're going to go ahead and start them on an antibacterial. First, what she's going to do is she's going to pee into a cup. Hand me that cup. I'm going to put the sticker on, send it to the lab. Then she's going to take a drug, and I'm going to write her a prescription for some OPO drugs when she gets home. But we have to ask a series of questions, and this is very, very important that you understand this. Because those of you that want to be practitioners in this classroom, I need you to think about the mindset, all right? So the female patient comes in, they say, I've got a UTI. What are the questions I'm going to ask the patient before I select one of these drugs? Good for you. Do you have any pain? You just push right here. Do you have any back pain? If it hurts, they'll hit you. They'll say, no, right? So you push. Do you have any pain right back here? How about back here? If she does have pain in the back here, then tell me what she has. She doesn't have a UTI anymore. It's a renal infection. And what was the name of the organism? Proteus. So we're going to have to select a different drug. And maybe we might even have to keep her overnight, depending. You can even get septic behind that stone. So you have to really take care of these patients. Okay? Any other items, any other questions that are very important that you ask these patients before you give them a prescription? Taking any prescribed medicines? There are drug interactions, aren't there? Do you have any allergies to known medications? Any other questions I should ask? So she says, no, I don't have any back pain. No, I don't have any allergies to medications. No, I'm not taking any other prescribed medications. Yes, sir.
Pregnant.
Are you pregnant or trying to get pregnant? Let's see why you would feel like shit if you didn't answer that question, if you didn't ask that question. Let's look at our study guide. Ciprofloxacin is the #1 drug we use for UTIs. Ciprofloxacin, what does that do? What is it? What is that family of drugs? Cipro belongs in what family? It's a DNA synthesis inhibitor. You think when a woman's pregnant, do you think there's any DNA synthesis going on? What do you think that baby's going to turn out like? And guess whose fault it was? It was yours for not asking her if she's pregnant or trying to get pregnant. Take a look at the antiribosomals. Do you agree that antiribosomals inhibit protein synthesis? Think there's any protein being synthesized in a pregnant woman? Again, whose fault is it? It is yours. If you're not a practitioner and you're a registered nurse, you have to keep your eyes open. You can't just go, oh, okay, you're pregnant, okay, here's some Cipro. Because you know what you're supposed to do? You're supposed to say, hold on, I'll be right back. You're supposed to say, hey,